think for a moment about the sheer volume of sensitive personal data that exists about you, especially, your health records.
Mhm.
Now magnify that complexity by millions for the men and women who served our country.
Right.
We're talking about the Department of Veterans Affairs. Their commitment to veterans relies entirely on, well, perfect accuracy and absolute security 204/7.
It's an enormous responsibility.
Today, we're taking a deep dive into the incredible efforts behind maintaining data quality and security for the VA and its Veterans Health Administration, the VHA.
They're really getting under the hood here.
We're pulling back the curtain on how they ensure the integrity of critical healthcare data for every single veteran.
And our insights, they come straight from some incredibly detailed documents.
Yeah, like their performance work statement and a related quality assurance surveillance plan. These really spell out exactly what's required for this vital work.
They lay out the blueprint,
Yeah.
essentially.
Our mission for you in this deep dive is to unpack the intricate layers of responsibility, technical expertise, and uncompromising standards that go into managing healthcare data on such a massive scale.
Helping you understand the unseen dedication behind the scenes.
Okay, let's unpack this. At its core, the VA's Digital Health Office and its data quality program are absolutely foundational,
Right, foundational.
providing essential benefits and services to veterans of the United States. It all starts there.
What's truly compelling here is how the Data Quality Program, or DQP, nestled within the Office of Health Informatics, acts as the absolute backbone for everything.
The backbone, okay.
It provides a comprehensive framework specifically designed to continuously monitor and improve the quality of all healthcare and supporting data across the entire Veterans Health Administration system.
So it's not just about one type of data, then. The source documents specify that these efforts encompass, well, everything.
Pretty much everything, yeah.
From managing veterans' identities for healthcare purposes to clinical data quality, data governance, and analytics. How many different groups, like within and outside the VA, does this massive effort touch?
That's a critical point because it shows the sheer scale of coordination. This isn't just an internal VA task, it's a vast, interconnected network.
So who are we talking about?
The documents list over 18 different internal and external mission partners involved. We're talking about groups like Identity and Access Management Services, staff from Oracle Health, the Department of Defense, the Social Security Administration,
Wow.
and even project teams like the Veteran Health Information Exchange, or VHIE.
VHIE, right, that helps share records securely.
Exactly. It helps securely share veteran health records between the VA and external healthcare providers. This means seamless care even if a veteran sees a doctor outside the VA system.
Okay.
It's a testament to how crucial collaboration is for delivering seamless and accurate veteran care across the board.
Here's where it gets really interesting, I think. The entire operation is built on an incredible stack of regulations and standards.
Oh, yeah.
We're talking about dozens of specific federal laws, directives, and technical guidelines. It's a mountain of rules.
It definitely is. But if we connect this to the bigger picture, this isn't just administrative overhead,
Right. It's there for a reason.
This extensive list, including acts like the Federal Information Security Management Act, FIPS publications for cryptographic security, the Privacy Act of 1974, and crucial high-pay security rules. Well, it forms the absolute non-negotiable legal and ethical framework.
Non-negotiable.
It ensures the highest levels of security, privacy, and accessibility for incredibly sensitive veteran data, highlighting that trustworthiness isn't just a goal, it's paramount to their mission.
Yeah.
Imagine the catastrophic patient safety implications if even one veteran's records were accidentally, say, cross-contaminated or misidentified due to faulty data.
Oh, absolutely.
These regulations are safeguards against exactly that.
It's impressive how thorough they are. Even standards like Section 508 of the Rehabilitation Act, which addresses electronic and information technology accessibility for individuals with disabilities, are integrated. And it mentions the DAMA guide to the data management body of knowledge. To me, that really underlines that this isn't just a government-specific set of rules, but one rooted deeply in industry best practices for data management.
Exactly. The DAMA guide, or Data Management Body of Knowledge, it's essentially the ultimate industry Bible for how to manage data effectively in large, complex organizations.
The Bible.
So, Yes, it emphasizes that these aren't just government-specific rules, but best practices adopted from the wider data management world, ensuring the VA is operating at the leading edge.
So with all these foundational regulations in place, what does this actually look like on the ground? What's the daily work involved in upholding these rigorous standards?
Well, the scope of work outlines very specific hands-on support services.
Okay.
This includes everything from meticulously reviewing business and technical project documents
Meticulously.
to ensure that defined requirements for clinical data quality and person identity management are properly incorporated. They're also constantly developing and refining the enterprise-wide requirements and business rules that govern all data.
So continuous refinement.
Think of it as proactive, continuous quality control built right into the system from the ground up.
I noticed the document talks about the VA Master Person Index, the MPI, which has been their enterprise identity management solution since 1998.
That's right, since '98.
It mentions modernizing its matching algorithm to a commercial industry standard probabilistic matching algorithm. That sounds incredibly intricate. What exactly does that involve?
It is incredibly intricate and vital. A core task is for the contractor to perform detailed analysis and reporting on this identity and person matching data.
How do they do that?
They use specialized software to analyze this identity data directly on the VA's own secured systems, crucially, without ever downloading sensitive veteran information offsite.
Ah, okay, that's key.
It ensures the integrity of unique veteran identities. And there's this explicit rule. It says, no VHA data will be downloaded to vendor-owned systems.
A strict rule. Good.
Yeah, it provides a critical layer of privacy protection. These analyses directly inform guidance and recommendations for how the system should be configured, supporting the VHA's massive electronic health record, or EHR, modernization efforts.
EHR modernization, right.
And they run these analyses about 7 times a year, usually in preparation for annual software upgrades. So they're constantly refining this kind of digital detective work.
And it's not just about the tech itself, is it? They're also heavily involved in composing new documents and reviewing existing ones.
Yes, a lot of documentation.
From detailed business requirement documents to high-level executive decision memos, that's a lot of paperwork.
It truly is.
Yeah.
But there's a vital reason for such an emphasis on document review.
Which is?
It's to ensure completeness, accuracy, and rigorous compliance with the VHA enterprise data quality requirements. Their central enterprise data catalog, and standards set by bodies like the VA Data Governance Council.
Okay.
They even identify data quality issues within these documents themselves, assign a level of complexity for their resolution, and then provide recommendations to leadership.
So they're catching problems early.
Exactly.
Yeah.
This isn't just about spotting errors. It's about systematically preventing them and integrating quality from the very start. The sheer volume ensures quality is baked into every step.
They also actively support data governance and data stewardship activities, which sounds like big picture oversight.
It is, but it gets very granular too.
But it also gets down to the level of assisting sites in meeting accreditation requirements by resolving reporting anomalies like missing data or incorrect coding.
Right, fixing those specific issues.
Plus, they develop and support dashboards for monitoring clinical data quality, looking for very specific things like NLO-LOINC codes or issues with clinical documentation integrity. What do those specific terms mean for, like, patient care?
Excellent question. NLO-LOINC codes, for example, refer to lab results that are missing a standardized digital identifier.
Okay, so no label, basically.
Pretty much. Imagine a lab result for a critical blood test that has no proper digital label. It can't be tracked or correctly associated with a patient. That could potentially lead to critical information gaps or even, misdiagnoses.
Yeah, that's serious.
And clinical documentation integrity, that refers to ensuring that all information within a veteran's health record is accurate, consistent, and complete, so healthcare providers have the full picture.
Makes sense.
Beyond these ongoing checks, they provide detailed data quality analytics services. These can be quick, ad hoc requests, like analyzing the data quality of specific identity traits for patient wristbands.
Like for a specific immediate need.
Exactly.
Yeah.
But they also include formal efforts for business process reengineering and quality improvement. They use established industry tools like healthcare failure mode and effect analysis, or HFMEA, and root cause analysis, RCA.
Those sound complex. HFMEA and RCA.
They are structured methodologies.
Mm.
These aren't just buzzwords. They are applied to critical situations like identified patient safety issues or maybe reports from the Office of Inspector General.
Okay.
They're about systematically finding why things went wrong, and how to prevent them from happening again.
It's clearly a nationwide effort, too. The document anticipates regular travel
Boots on the ground.
to a specific list of destinations, including Tampa, Washington, D.C., Salt Lake City, and St. Louis. That really brings home the practical, on-the-ground scale of this work. It's not just some abstract digital process.
Not at all. It requires presence and direct interaction.
Perhaps one of the most striking parts of this deep dive is the almost unparalleled level of security and privacy built into every single aspect.
It has to be.
We're talking protected health information, PHI, and electronic protected health information, EPHI, incredibly sensitive stuff.
What really stands out here is the sheer detail of the security requirements. Given the highly sensitive nature of the data, any contractor involved is required to have a signed business associate agreement.
A BAA, right. That's standard for healthcare data.
It is, but it's a legally binding contract, ensuring they will protect private health information with the same rigor as the VA itself. Beyond that, every single individual working on this requires a background investigation.
Everyone.
Everyone. And they must obtain a personal identity verification or PIV credential. This is like a high security badge needed to even access VA facilities or IT resources.
Okay, so tight access control.
Very tight. The document even specifies a contractor staff roster must be submitted within 3 business days of the contract award and updated within 1 day of any employee status change.
1 day.
It's about knowing exactly who has access at all times.
They even get into the nitty-gritty of how IT products are procured, specifically stating no used, refurbished, or remanufactured equipment or parts.
Yeah, that caught my eye too.
And absolutely no gray market goods or counterfeit electronic parts. That's an extraordinary level of caution for hardware.
It truly highlights an incredibly holistic approach to security. It extends trust beyond the data itself to the very hardware and software it runs on.
So the physical components matter just as much.
Absolutely. They require a software bill of materials, or SBOM, for all procured products. Think of that as a complete ingredient list for every piece of software.
The ingredient list for software, I like that.
And they demand tamper-evident packaging for physical deliveries.
Tamper-evident packaging.
Yeah. This shows an astonishing level of scrutiny, from ensuring the authenticity of components from the original equipment manufacturer, or OEM, all the way down to physically securing the packaging from the moment it leaves the factory.
So no weak links in the supply chain.
It's about preventing any potential backdoor or vulnerability from entering the system at any point.
And what about the ongoing maintenance of software, like patches and updates? That's a constant battle for any large organization.
It is, and the document outlines rigorous patching governance.
Okay, what does that involve?
For critical or emergent vulnerabilities, think immediate high-risk security flaws updates must be provided within 7 business days of discovery.
7 days for critical issues. That's fast.
It has to be. For all other vulnerabilities, the time frame is 30 business days. This isn't just good practice. It's an essential, proactive measure for protecting systems as vital as those handling veteran healthcare.
Essential, yeah.
They even require contractors to explicitly attest that their software and patches are free of viruses and malware.
So they have to guarantee it's clean.
It's an unbroken chain of trust.
So with all these complex processes, high stakes, and incredibly detailed requirements, who's actually doing all this work? And how is it ensured that it all meets these extremely high expectations?
Well, the document is very clear on the caliber of personnel required.
What kind of people are we talking about?
They mandate senior-level SMs analysts, that's subject matter experts, who have deep expert knowledge and abilities in data quality, identity management specifically within the healthcare domain, data governance, data stewardship,
A whole list of specialties.
and extensive experience with industry-standard tools in large-scale healthcare system implementations. While no single individual needs every skill, the combined team must meet these high standards.
So you need a really strong team.
Exactly. This ensures they have the depth of expertise to navigate this highly specialized and critical domain.
And it's all about ensuring that the deliverables, whether it's a critical recommendation or a complex analysis report, are not just accurate, but also timely.
Right, timeliness is key.
There are strict review and revision cycles. The government has 10 business days to review, and the contractor 5 business days to incorporate feedback. That's a tight turnaround for such complex work.
It is, and this whole framework, including the explicit use of a Quality Assurance Surveillance Plan, or QASP,
The QASP, right?
is designed for continuous, systematic oversight. This QASP assesses how well the contractor integrates coordinates all activities needed to execute the contract, ensuring that performance is not just met, but consistently excels.
Consistently excels.
It's a profound commitment to sustained excellence in supporting our veterans, making sure every piece of their sensitive information is handled with the utmost care and precision.
Today, we took a deep dive into the incredibly detailed world of data quality and security within the Department of Veterans Affairs.
We really did.
It's a domain where the abstract concepts of data integrity meet the very real mission of serving our veterans and safeguarding their most sensitive information. It's truly a hidden layer of dedication.
We've seen how rigorous standards, deep technical expertise, and an unwavering commitment to both privacy and supply chain security combine to protect some of the most sensitive information imaginable within a massive interconnected system.
It really is immense.
It's a testament to the immense ongoing effort that often goes unnoticed.
So, the next time you hear about data quality or cybersecurity, perhaps you'll think about the complex web of federal regulations, the advanced probabilistic matching algorithms we talked about, and the dedicated experts working behind the scenes to ensure that critical information, especially in healthcare, is not just accurate, but absolutely secure and accessible.
Yeah, hopefully this gives a little insight into that.
What surprising hidden layers of precision and protection might exist in other essential services we use every day, services we often take for granted because of the tireless work happening behind the scenes.
That's a great question to ponder.